Hello and welcome to St. Lucia Magazine, your weekly roundup of the nation's top stories in education, the economy, infrastructure, agriculture, and more. I am your host, Kendall Eugene, standing in for Nivalu Geist. In this edition, rising global oil prices have a domino effect on fuel costs in St. Lucia. And the island boosts surveillance after the World Health Organization declares Ebola a public health emergency of international concern. Rising global oil prices, driven by ongoing conflict in key energy-producing regions, are beginning to impact fuel costs in St. Lucia. Melissa Paul tells us more.
Over the past few weeks, the price of oil on the international market increased because of war and instability in parts of the world that produce much of the oil used globally. Most people understand this from everyday life. When the cost of a product goes up, eventually, the customer pays more too. Fuel is no different. When oil prices rise overseas, countries like St. Lucia eventually feel the effects. But that's only part of the story. The other part is what government is doing to help. Rather than passing the full increase on to consumers, government currently contributes 86 cents on every gallon of gasoline sold and $1.21 on every gallon of diesel sold. That means if a driver purchases 10 gallons of diesel, government pays $12.10 of the cost. Government is also helping to keep cooking gas prices stable. The 20-pound cylinder used by many families every day remains $34. Without government support, the same cylinder would cost $70. The 22-pound cylinder remains $38. Without government support, it would cost more than $76. In fact, government contributes more than $35 toward every 20-pound cylinder sold and more than $38 toward every 22-pound cylinder sold. The reality is simple. St. Lucia cannot control the international price of oil. What government can do is help reduce the impact on families, workers, commuters, small businesses, and households. This is why government continues to help cover part of the cost of fuel and maintain stable cooking gas prices despite rising international oil prices. So while fuel prices have increased, government continues to share part of the burden and to help protect consumers from the full impact of rising prices. That's the full story behind the latest fuel price adjustment.
Health authorities in St. Lucia are strengthening surveillance and preparedness measures following the World Health Organization's declaration of the Ebola outbreak a public health emergency of international concern. Chief Medical Officer Dr. Sharon Belmar-George provides the details.
On May 17, 2026, the World Health Organization declared the ongoing Ebola virus disease outbreak affecting the Democratic Republic of Congo and Uganda a public health emergency of international concern under the International Health Regulations 2005. The declaration of a public health emergency of international concern underscores the need for heightened international and regional vigilance and coordination, especially given the current situation in conflict-affected regions with limited access to healthcare services. Although at present, this event is not classified as a pandemic, coordinated international action is required. The current Ebola outbreak is concentrated in the Eastern Democratic Republic of Congo, Ituri, North Kivu, and Sud Kivu provinces, and Uganda, particularly Kampala. The cause is the Bundibugyo Ebola virus strain, which is relatively rare, for which there are no licensed vaccines or specific therapeutics. As of May 27, 2026, there were 1,018 total cases, including 1,011 in the Democratic Republic of Congo and 7 in Uganda, and 234 deaths, 233 in the Democratic Republic of Congo, and 1 in Uganda, with a case fatality rate of approximately 23%. There are no cases of the Ebola virus disease in the Caribbean region. The current risk of this disease in the Caribbean is assessed by CARPHA as low. However, given that the introduction of the disease to the Caribbean region can happen through travel associated with importation and the region's high connectivity through international travel, it is important that the national surveillance system is strengthened. Ebola virus disease is a severe and often fatal disease caused by viruses in the genus Ortho-Ebola virus. The current public health emergency of international concern is as a result of an outbreak caused by the Bundi-Bugyo strain. Historically, the case fatality rates range from 30 to 50%, and the incubation period is between 2 to 21 days. The common symptoms of the Ebola virus include fever, severe headache, muscle pain and weakness, fatigue, sore throat, vomiting and diarrhea, abdominal pain, and unexplained bleeding and bruising. Severe illness may progress to multi-organ failure, shock, and death. The Ministry of Health, Wellness and Nutrition is closely monitoring the outbreak and preparing plans for prevention, early detection and management in country in consultation with the regional public health agencies. Surveillance is being strengthened at the level of the ports and travel history screening. Health systems are being strengthened through the development of national preparedness plans for viral hemorrhagic fevers, healthcare worker sensitization, reinforcing infection prevention and control measures, review of personal protective equipment, and ensuring clear protocols for safe patient management. Testing capacity for Ebola virus disease is not available in the Caribbean region. The Ministry of Health is also working with the regional public health agencies to coordinate sample collection and transfer to CDC Atlanta if the need arises. During the coming week, the Ministry of Health is scheduling extensive stakeholder presentations and discussions with health, tourism, education, and the business sector to strengthen coordination and collaboration in matters relating to Ebola virus disease. The Health Education and Communication Unit is developing the risk communication plan to facilitate the delivery of targeted evidence-based messages to the public to support early recognition and adherence to country guidelines for care and management. The Ministry of Health will continue to monitor the global development of the outbreak and provide regular reports and updates.
In more health news, the Ministry of Health is encouraging St. Lucians to make a healthier food choice as part of ongoing efforts to combat hypertension and diabetes. Onika McCoy has the details.
The Nutrition Unit within the Ministry of Health, Wellness and Nutrition, in collaboration with the Capacity Building Project for Prevention and Control of Metabolic Chronic Diseases in St. Lucia, recently hosted an activity aimed at encouraging healthier eating habits and reducing the risk of chronic non-communicable diseases. Held under the theme Better Eating for Healthy Living, the initiative formed part of activities to observe World Hypertension Day and Salt Awareness Month. The event, held at the Labry Wellness Center, focused on educating participants, particularly individuals living with hypertension and diabetes, on practical ways to reduce salt and sugar consumption while maintaining flavorful and balanced meals. Nutritionist Fadia Campbell explained that the demonstration highlighted the preparation of low sodium and no added salt dishes using food items from the 6 food groups to encourage balanced nutrition.
So the goal of this initiative today is to sort of educate the participants in giving them the practical skills that when they go home, they're able to prepare their foods using local herbs and seasonings, and to limit or restrict as much as possible added salt or sodium to their diet. Also, portion control is another aspect of this activity today, where they will be able to visualize the amount of food that they can put on their plate using the various food groups or various meals that they cook.
Community health nurse at the Labrie Wellness Center, Kathleen Charles, reported a total of 140 patients diagnosed with high blood pressure, 61 with diabetes, and 112 living with both conditions in Labrie and surrounding areas.
We have a total number of 140 clients diagnosed with diabetes, 47 of which are male, 93 female. And then to break it down just a little for you, we were looking at those who are 50 and lower than 50. So we have clients, out of that figure, clients above 50, we had a total of 121, and below 50, we have 19. Okay, let me tell you for diabetes, remember our focus is high blood pressure, but just to let you know, diabetes, we have a total of 61 clients, 15 of which are male, 46 female. Above 50, we have 56. Below 50, we have 5.
Project coordinator for the Capacity Building Project for Prevention and Control of Metabolic Chronic Diseases in St. Lucia, Jessica Wu, says the key to changing those numbers lies in small, consistent steps, beginning with the decision to get screened.
I will say the screening is so important. We want to detect the high-risk conditions so we can have earlier intervention to tackle the things. As earlier we just mentioned that the small change, I will believe small change one day, one time to time, we can make the big difference. So I will say that our slogan is here, health, habit, health, life. Let's start today. Thank you.
Health officials say this cooking demonstration is one of several initiatives supported by the Metabolic Chronic Diseases Program, with a broader goal of reducing hypertension and diabetes island-wide and empowering St. Lucians to make healthier choices, starting with what they put on their plates. Reporting from the Communications Unit of the Ministry of Health, Wellness and Nutrition, I am Onika McCoy.
Still to come, laboratory systems across the Eastern Caribbean work to improve their emergency response processes. Stay with us.
Today we recognize and celebrate your successful attainment of CTA-endorsed partnership status. This moment is more than receiving a title. It reflects where tourism in St. Lucia is going and who is leading that future. It represents a shift in our tourism model, one that places community at the center, prioritizes local ownership, and ensures every visitor experience is grounded in authenticity, safety, and excellence.
Your business carries a seal of excellence defined by 3 powerful pillars. First, ownership. You have proven that the community is not just an attraction. You are the decision makers. These experiences are designed by you, led by you, and shaped by your reality. Second, integrity. You have demonstrated that high standards and authenticity go hand in hand. Your commitment to safety and professionalism proves that local is also world-class. Thirdly, impact. This endorsement signifies fair economic benefit. It means that when you succeed, the community succeeds. It ensures that traditions are preserved, the environment is protected, and revenue stays where it belongs, in the hands of the people who call St. Lucia home. May we at the Community Tourism Agency, alongside you, our CTA business partners, continue to set the standard for tourism, delivering experiences of the highest quality, authentic and community-driven.
Welcome back. Health officials and regional partners are working to strengthen laboratory systems across the Eastern Caribbean to improve disease surveillance, outbreak detection, and emergency responses. Fidel Neptune reports.
Efforts to enhance disease surveillance, outbreak detection, and response through stronger laboratory systems across the Eastern Caribbean is underway, following the recent stakeholder consultation on establishing tier-based laboratory networks convened by the Pan American Health Organization, PAHO. The consultation, which took place at the Harbour Club Hotel, brought together stakeholders involved in healthcare and laboratory services across the Eastern Caribbean, representatives from sub-regional reference laboratories, and international partners. The consultation was aimed at increasing awareness among stakeholders about the requirements for the development of a framework for tier-based laboratory network aligned with the International Health Regulation, IHR, and Universal Health, UH. PAHO Advisor for Health Systems and Services, Vishwanath Pratap Singh, spoke on the objectives of the stakeholder consultation.
One of the key objectives is to have that conversation with them, build some understanding of what are the key tenets of a tier-based laboratory networks, what benefit can be added from them, what is your current capacity, how countries are currently set up for these, and what are some next steps that could be done. The other one is around taking a little step on the side and looking at what is capacity or what advancements have been made in capacity in countries for the international health regulations, in alignment with the international health regulations. And then there's also, about sharing experiences. Countries who are at different points in the journey towards strengthening their laboratory networks and setting up tier-based networks. How can other countries learn from or build on those kinds of experiences?
Medical Officer of Health, Dr. Glensford Joseph, says this consultation is very timely for St. Lucia as it provides the opportunity to engage with other OECS member states as we work towards the strengthening of laboratory services.
This consultation really would give us an opportunity to review our laboratory framework and to identify area of challenges that we can build towards establishing a more robust laboratory system to deliver services, not only at the national reference laboratories and the hospitals, but also as we work towards a tiered-based approach as we prepare to roll out laboratory services at the community levels, especially in our polyclinics.
Dr. Joseph also noted that the Ministry of Health is appreciative of this consultation as it allows for the refining of policies and action plans for strengthening laboratory systems, which will play a part in achieving universal health coverage and strengthening outbreak preparedness.
Having a very strong laboratory network, especially in a tiered approach, will allow the decentralization of services so that people can access services, especially in their communities. And this will be very important as we continue to roll out our universal health coverage package. More so, this consultation will allow for the strengthening of our national surveillance capacity, as laboratory diagnosis is a critical component in allowing for the confirmation of pathogens that are contributing to outbreaks and for the better management of such an outbreak. It will allow us to better manage the patient as well as to bring the outbreak under control very swiftly.
PAHO is hopeful that through the stakeholder consultation, countries in the Eastern Caribbean, such as St. Lucia, Grenada, and St. Vincent and the Grenadines, will make strides towards developing a tier-based laboratory system that will better serve their populations. Reporting from the Ministry of Health, Wellness and Nutrition, I am Fernal Neptune.
St. Lucia observed the National Day of Caring on June 7th. The initiative promotes strengthening community bonds through acts of kindness and service. We hear more from the Deputy Permanent Secretary in the Ministry of Equity, Karen Dupree.
Fellow St. Lucians, today, June 7th, as we observe National Day of Caring under the theme Empowering Communities Through Health, Care and Compassion, we are reminded of the power of compassion, kindness, and human connection in strengthening our communities and uplifting one another. This year's theme focuses on the importance of health and wellness as a fundamental priority in caring for individuals and communities. The initiatives surrounding this observance aim to promote compassion, community support, and access to basic health services while assisting vulnerable groups, including hospital patients, patients with disabilities, the bedridden, and people experiencing homelessness. Caring is more than an act. It is a reflection of our shared responsibility to support the vulnerable, encourage those facing hardship, and ensure that no one feels forgotten or alone. Your efforts make a meaningful difference in the lives of countless individuals across our nation. As we commemorate this important day, let us recommit ourselves to fostering a culture of kindness, inclusion, solidarity, where every person is valued and supported. Together, through caring for one another, we strengthen the foundation of our more equitable, healthier, and more compassionate St. Lucia.
Coming up next, NELU to deliver skills training directly to communities.
Département écoutez, justice sociale, gender et puis droits citoyens, car informer public là et envoyer paiement approcher 1200 familles qui te ka hen bénéfice à bas programme assistant public. Département ka implémenté décision ça là parce que ces familles ça là participer à dans deux process review qui prend cours en l'année 2025 et puis l'année 2026. Département comité pour un service pour toute famille qui qualifié et puis qui a participé à dans process review. Moun qui zahen affecté par décision ça là, département ka encouragé pour contacter département à numéro 7 D 3 D 3 99 ou 7 D 4 8 957 ou visiter office welfare qui est en commune. Département écoutez justice sociale, gender et puis droits citoyens voulez remercier public là pour coopération et puis la comprendre.
Welcome back. The National Enrichment and Learning Unit is expanding access to skills training through a new community-based initiative that will bring certified training opportunities directly to communities in order to improve the employment potential of participants. Here's Ryan O'Brien with the report.
The National Enrichment and Learning Unit, NELU, has introduced an initiative to start its rebranding process. One of its programs has been coined NELU on Wheels, which is geared at bringing training to communities once facilities are available. Its latest stop was in Vieux-Fort South.
Currently, approximately 120 learners from 3 other constituencies are benefiting from such a program: Vieux-Fort North, Dennery North, and Dennery South. This initiative is just not another program. It is a lifetime of opportunities for everyone. The unemployed youth, the underemployed, those who have little or no certification, most especially the young men and women of our communities who are just seated there not doing anything.
Central to the success of this initiative is a partnership with the parliamentary representative for Vieux-Fort South, the Honorable Danny Butcher, who is also the Minister in the Ministry of Education and Digital Transformation, responsible for early childhood education, continuing education, and digital transformation. Minister Butcher was present at an orientation ceremony at the Vieux Arts and Craft Entertainment Center. He encouraged those present to make the most of this life-changing opportunity, which was of no cost to them, and called upon the business community to resist discriminating against persons from stigmatized areas by affording them opportunities to advance themselves.
Because as I move around the constituency, I meet young people who are hopeful, I meet young people who are passionate, I meet young people who are forward-thinking, and I believe it's time for our business community to really hone in and bring them in. And not that you're doing it, but I want to let you know that I do not want any form of discrimination against those wonderful young people. When you look at the address and you see the address says Bruceville, they're really passionate about what they do. You could give them a chance. When you look at the address and it says from the back of there, I want you to give them the opportunity because they're really passionate. They know what they're doing. Give them an opportunity to be successful.
Sessions for participants in Vieux South will begin this month and end in December. Candidates will be assessed in January 2027 and, if successful, will attain Caribbean Vocational Qualification CVQ. From the Department of Education and Digital Transformation, I'm Ryan O'Brien.
And to round off this week's recap, mathematics students in grade 5 recently tested their skills at a national competition. Once again, here is Ryan O'Brien.
The annual grade 5 National Mathematics Competition took place recently at Spartans Health Sciences University School of Medicine. The 8 competitors won their district's mathematics quiz to qualify. Hachette Learning was a major sponsor of the event. Company representative Sophie Girau says they were happy to be associated with an initiative promoting excellence and critical thinking among young learners.
Competitions such as these inspire students to challenge themselves and to develop confidence in their abilities. Hachette Learning remains committed to educational development throughout the Caribbean. As publishers of the Caribbean Primary Mathematics Series and the Problem Solving in Mathematics Series, we are delighted that these resources continue to assist students and teachers in preparing for opportunities such as today's competition.
Education Officer District 6, Stephen O'Geese, congratulated all participants for showing commitment to mathematics and stressed on the importance of such activities.
There are few sights more inspiring to a nation than the disciplined minds and determined spirits of its young people assembled in the pursuit of excellence. Today, as we gather for this year's Grade 5 National Mathematics Quiz Competition, we celebrate the triumph of preparation, perseverance, courage, and intellectual endeavor.
Officials in attendance were unanimous that the students displayed a high command of the subject. Josiah Seeley Alcide of the Dame Purlette Louise Primary School, District 1, emerged as the champion with a total of 36 points. Second place went to Lenica Valsin of the Ansare Primary, District 4, with 32 points, while Jency Cotter of the Bellevue Combined School, District 6, placed third, registering 30 points. From the Department of Education and Digital Transformation, I'm Ryan O'Brien.
And with that, we wrap up this edition of St. Lucia Magazine. A heartfelt thank you to everyone who contributed to this production, the National Television Network, the GIS team, and the communications officers across government ministries. Thank you for watching NTN Channel 122 and following the official social media platforms of the Government of St. Lucia. I am Kendall Eugene, standing in for Nival Auguste. Until next time, stay informed, stay engaged, as we continue tracking St. Lucia's progress.